My name is Albert Wagura Taiti. I'm the County Executive Committee member for Health in Laikipia County, or Waziri for Health in Laikipia. And we are here this morning to clarify and also confirm on the issue of the Mpox infection cases, which have already been confirmed in Nyahururu, in our Nyahururu County Referral Hospital. And I know there has been some unconfirmed information in the public, and we now want to really confirm it so that we can be able to allay fears and let the public know exactly what is happening. And of course, Mpox cases have been confirmed in other counties previously, but this case it is now with us. We have already confirmed 2 cases of Mpox, which is a couple, a man and a wife, who are admitted in Nyahururu in isolation. They also have their 2 children, a child who is 3 years old and another one 3 months old. The children are not sick. They are not ailing, but the parents, that is the father and the mother, the samples collected have confirmed they are the ones who are suffering. But the children could not be left in the house because being 3 years and 1.5 and 3 months, those are too young to be left in the house. So they are also in Nyahururu Hospital, kept there not because they are sick, but they have been kept there because there is nobody to take care of them at home. The patients have been there since for about 3 days, and they are doing quite well in isolation. They are under treatment, bearing in mind that Mpox is a viral infection. It doesn't have a specific cure, and therefore it's just a matter of conservative measures and of course proper infection prevention control, where we have already equipped our staff and all those people who are taking care of them. It is also imperative to note that that these 2 cases of Mpox, they did not originate from Laikipia. They originated from Nyandarua, that is within, I think it is within the Ragwa constituency, and because Nyahururu is their nearest hospital, that is how they ended up in Nyahururu. However, we are in very, very good working relations with Nyandarua County. We have been in close contact with the teams that are involved, starting with the CECM, my counterpart in Nyandarua, and also their surveillance team, disease surveillance team. They are already on the ground. They have traced contacts. And the contacts traced, those who have been in contact with the patients, is only a sister to the lady or the wife or the mother of the children who is admitted, and 1 young man in I think Reshao Secondary, and all of them have been contacted, and because they are not positive, all that can be done is what we call self-monitoring, but we are also looking closely so that we don't have new cases. It is also good to note, and this one is good for the public, that Mpox cannot be transmitted airborne. It cannot be transmitted through the air, but it can only be transmitted through close contact, body contact, and therefore that is how these people, that is how these others were not able to get, and we are also allaying fears from the people that maybe it may spread through the air. That is not true. The patient who is admitted, the index case, that is the man, and the father of the household, had traveled about 3 weeks ago, had traveled to Mombasa. We are not very sure whether that is where he got it from, but that is the only history we have of travel to Mombasa. And when he came back after that, that is the time he presented with some signs and symptoms. Those are rashes and those other symptoms, and that is how through these samples it was discovered that is Mpox. And therefore we are working very, very closely with the Nyandarua County, the surveillance team, the health management team, and we are really containing. And it is also good that to alert you that by Thursday and Friday last week, the whole of all the health workers in Laikipia, the whole fraternity of health workers in Laikipia, they were taken through a refresher course on disease surveillance. It was not because this case had been discovered. It was our routine refresher course trainings, and therefore by design it coincided with what is happening. So our teams are very, very, very well prepared, and we are up to these cases, and we can assure the public that all is well and well contained. There is no cause of alarm, and we shall continue informing them of the progress. Our patients are doing very well, and therefore they should not get worried. We have not traced any other person with the Mpox, and we have really followed all the contacts. Thank you so much.